Now, to unpack this matter, we're now joined by Salomé Meyer, who is from the Cancer Alliance, and she joins us now via our video link. Salomé, thank you so much for your time this evening here in SABC News. Now, would you say that the Gauteng Health Department is failing its cancer patients?
Good evening to you and the listeners, and thank you very much for this opportunity. Yes, indeed, they are failing cancer patients. The backlog list that we presented to the Department of Health contains the names of nearly 3,000 patients. Some of these patients have been waiting, as I indicated in that interview, for more than 3 years to hear whether they are indeed going to get treatment, yes or no. So when the department has been allocated the specific amount of 250 million to treat those specific backlog patients, and they still haven't done anything about it, meaning not one patient has actually received any treatment from that allocated amount of money, then yes, they are failing in their duties to actually perform services.
And what have been the reasons being given to some of these patients when it comes to this backlog being faced by the Gauteng Health Department?
The reasons that they initially put on the table, and that we also understand, that is the situation at Charlotte Maxeke, has to do particularly with, first of all, the lack of enough equipment to actually do all the treatments. Then they also have not enough staff to manage the current even waiting list that is associated with the lack of enough equipment. So between the situation of equipment as well as healthcare professionals, you then had the situation where the actual backlog list was building up and building up and building up. And over years, that grew to 3,000 patients. Currently, they then have a waiting list. And it is very important that you distinguish between patients that have been on a backlog list for more than 3 years and current patients that are just on the waiting list and that are indeed actually getting their treatment. There is a difference between the two.
And what then does this all mean for somebody who is treating, their cancer?
So for a person that is currently under treatment, they are obviously or currently awaiting their treatment. Obviously, they are being dealt with by the Gauteng Health Department, and we're specifically referring to Charlotte Maxeke, not to Steve Biko, where we also know that there are a shorter, much shorter backlog list. But when we're talking about Charlotte Maxeke, we know that the patients that are on current waiting lists are being seen. But the backlog patients, those are the patients that are they don't even receive any communication from the department. They are still waiting to hear what is going to happen to us. And that is unfair.
And how important is this radiation therapy or treatment for somebody who is suffering from cancer?
It is a vital treatment to receive. I mean, obviously, if you've been earmarked for radiation treatment, the international guidelines differ then for your specific cancers in terms of how soon what is your window period. But for most of these patients, we are talking about a window period of 120 days within which you actually have to have your treatment once earmarked for that. After that, you actually have to be re-evaluated and determine whether you will, what is now happening, has your cancer spread, or will you benefit from treatment? And that, in fact, is what we have seen with 2 of our breast cancer patients. The first one was the patient that actually indicated that she had received the message that, sorry, treatment is no longer going to benefit you. That is after waiting for more than 3 years. And the other patient that we have as part of our court case, actually her cancer, she was re-diagnosed with a cancer and had to first again then go back for additional chemotherapy and only then to receive treatment.
And during COVID-19, I remember the Charlotte Maxeke facing great difficulty there with the fire. Did this impact the current backlog that we are seeing now?
Yes, the fire impacted the backlog to a certain extent, but should not at all be used as an excuse by the department, by the Gauteng Health Department. The Gauteng fire was, quite honestly, that was a matter of bad maintenance. But whilst the fire, so the hospital closed for a period, and then shortly after that, the radiation department actually was one of the departments that actually could resume their services to patients. So no, not necessarily. The fact of the matter was that already at that time, there were not enough staff and equipment to manage the current load, or the load at that time, in terms of treatment of patients.
And of course, there are these reports of 784 million rand that was said to be earmarked to be used by the department when it comes to radiation therapy and surgical backlogs. If we're seeing an amount of this nature which was unused, how concerning is it for the thousands of people who need this cancer treatment?
So I think we need to put it in perspective. The 250 million that was allocated for outsourcing services. So yes, the department have allocated 17% of that, 250 million already, to a planning contract. And then they are now busy finalizing the outsourcing of treatment, and we are uncertain how many of the backlog patients will indeed actually benefit from that. Then the department was at the remainder of the money, that is then 500 and whatever the amount is. That amount would then be transferred to the department in 2 tranches. So for this budget year, they were allocated the amount of 261 million rand. And we are not even sure what they are doing with that 261 million rand, whether they are buying equipment, new equipment to actually deal with the backlogs, and just actually upgrading the various services at the various hospitals.
All right, Salomé, thank you so much for your time and for the clarification. That is Salomé Meyer, who is from the Cancer Alliance, just talking there about that court action that has been taken against the Gauteng Health Department in concern to cancer treatment.